Over the past 45 years, WHO has provided global leadership in many aspects of human reproduction through supporting and implementing research, building research capacity, especially in developing countries, and developing norms and standards to guide countries in providing service safely, effectively, and equitably. Our work guides national family programs so that they can offer women and couples the widest possible choice of safe and effective methods.
WHO's engagement in contraceptive development dates back to 1965, when the 18th World Health Assembly made a resolution that WHO should establish a human reproduction unit, which subsequently transitioned into the expanded Programme of Research, Development and Research Training in Human Reproduction, in short the Human Reproduction Programme, or HRP. HRP's aim is to support development of a variety of safe, acceptable and effective methods for fertility regulation and of monitoring the long-term safety and efficacy of existing methods, as well as the support of institutions capable of conducting such work. In 1988, the United Nations Development Programme, the United Nations Population Fund and the World Bank joined WHO as HRP's co-sponsors, and in 2012 UNICEF became the fifth co-sponsor. Since 1998, HRP has been managed by WHO's Department of Reproductive Health and Research and remains the main agency within the UN system providing guidance on sexual and reproductive health and rights. The work of the HRP and the Reproductive Health Department is guided by WHO's Global Reproductive Health Strategy, which was adopted in 2004 and is as relevant now as it was then. The strategy focuses on 5 priority aspects of reproductive and sexual health, one of which is providing high-quality services for family planning, including infertility services. More recently, the Global Strategy for Women's, Children's and Adolescents' Health, which was launched by the UN Secretary-General, provides an operational framework within which countries can continue to implement the Global Reproductive Health Strategy.
Research supported by HRP in its early years demonstrated the importance of generating evidence that still impacts on which contraceptive methods are available and how they are provided. Investments in contraceptive technology development have been guided by research and the development of new and refinement of existing contraceptive methods will continue to benefit from such evidence. In the 1970s, for example, WHO generated evidence about which attributes would make contraceptive methods acceptable to women, such as how it is used, how long it is effective, and what side effects may occur, as well as attributes of family planning services, such as accessibility, cost, privacy, and courtesy of staff. This type of information continues to be essential for countries as they seek to reduce the unmet need for contraception.
From the 1980s onwards, HRP undertook a large number of research studies to determine the safety and effectiveness of many contraceptive methods. Some key findings from that research include, for example,
using progestogen-only contraceptives during breastfeeding has no known adverse effects on infant growth or development. The risk of pelvic inflammatory disease for women using an IUD is extremely rare and mainly occurs during the first few days following insertion. Oral pill use protects women against ovarian and endometrial cancers. And long-term studies conclude that copper IUDs could be used safely and effectively for up to 12 years.
Our rigorous research reassures regulatory bodies, ministries of health, and most importantly women and their partners, that currently available methods are safe, effective and should be made widely available. WHO continues to support such research to develop and update the medical eligibility criteria for contraceptive methods and selected practice recommendations for contraceptive use. These are guidance documents that continue to be the cornerstones for implementing family planning programs around the world. More recent examples of our research on individual contraceptive methods includes determining whether there are interactions between use of combined oral pills, exclusive breastfeeding and infant growth, specifying the duration of effectiveness of the latest generation of implants, and determining the safety and effectiveness of using emergency contraceptive pills regularly. We are also supporting research to increase the range of methods that protect against both pregnancy and sexually transmitted infections, including HIV. The exponential increase in the numbers of women and couples wanting to use effective contraception has led to virtually all countries creating family planning programs. Consequently, much of our family planning research today focuses on identifying ways in which national programs can ensure access to a full range of affordable methods through high-quality services, and can do so equitably so that everyone that wants to use a contraceptive method can do so. Some research questions include: which cadres of health workers can safely and effectively provide which methods of contraception? How can sexually active adolescents access contraceptive methods that are acceptable, affordable, safe and effective for their lifestyles? And how can health services support new mothers transition to using effective contraception after breastfeeding? In conclusion, WHO continues to provide global leadership in the development and delivery of effective contraceptive methods through generating evidence about their acceptability, safety, effectiveness, affordability, and how they can be delivered equitably and affordably to whoever needs them. Through our research and the programmatic guidance based on the evidence generated, we are enabling women and couples to enjoy their right to choose when and how many children to have.